And so these 1 hour sessions, for me at least, fly by so fast because they're only 1 hour. But we are now at workshop 4 of 5. So today's topic is the implementation phase of design thinking. And I'm joined today by Melissa Carrier, who oversees social innovation pan campus for UNC, and then Emily Skywork, who is a second-year health behavior MPH student and my design thinking fellow. And so we are going to get started because we have a lot of content for today. As a reminder, the workshop is equipped to make sure that our faculty participants learn more about design thinking mindsets, processes, and tools to give you all some time to actually apply all these things to a specific challenge or problem of interest, and then connect you with other folks across campus, and then experts like Melissa across campus so that you can continue your work beyond the 5 weeks that we are together. And so with regards to the workshop arc, we are already at workshop number 4, implementation. And so next week we will have a Pathways to Impact workshop where we will start to think through what's next. So how you can continue to plug into parts of our ecosystem here at UNC and which experts you want to continue conversations with so that you make sure that you have the support that you want and need as you move your ideas forward. And so today's agenda, we are going to start with something called Dish It Out as a warm-up. Recap design thinking. I'm going to give a brief implementation phase overview with a case study of a project that I'm currently working on. And then we're going to ask you to reflect on benchmark indicators as you move forward with your work, and then end with next steps. And so with regards to housekeeping, as always, we will send you the PDF versions of the slides after today, as well as the recording. If you have questions as we go, feel free to both type into the chat or unmute yourself. And we do encourage you to turn your camera on since we are such a small group. Okay, so starting with Dish It Out, we're going to imagine that your solution, so however you define that, whether it's a product or experience, is a meal or a beverage. And so we would like you to think about what it would taste like, what it would smell like. Is it complex or simple, classic or innovative, sweet or savory? And take a few minutes to design a meal, cocktail, or mocktail that represents the essence of your product or experience. And then you're going to do that by yourself and come back and share as a whole group. I've allotted 5 minutes, although you all might be able to do this in less. And so I'll check in about 3 to see how you all are doing. But again, this is meant for you to think about your solution a little bit differently as a warm-up. And so feel free to interpret this prompt as you would like. And I will set a timer for 3 minutes and see how we do and see if we need to add more time. Any questions before we get started? All right, if not, we will check back in 3 minutes and see how you're doing. Ready, set, go. 30 more seconds. Time. All right, so knowing that these are all works in progress, it'd be great to hear where you are and you're thinking about translating your solution to some sort of edible meal or beverage. And so as you describe your creation, it'd be great if you can also discuss why you think it represents your solution. And so do we have a volunteer to go first?
I can go first. So my creation would be a meal that is like molecular gastronomy, super precise. Everything is highly organized, super precise. I guess it would taste savory. It's more something that has never been done before in that way. And I don't know, it probably tastes good. That's what I was thinking.
Great, that was very visually descriptive for me. Kate or Will?
Go ahead. So the problem the solution I have is to be able to characterize particles more accurately and without artifacts and other methods allowing you to see things more in detail. So I liken it to a T-bone steak, right? You don't want to put sauce on that. You don't want to put anything on that, right? Just maybe some salt, some olive oil before you put it on the grill, right? Otherwise, you don't get the detailed intricacies of the meat itself, right? That would be lost if you put a sauce on that or something crazy, right? Also, how you grill the steak is very important, right? Whether you smoke it with different kinds of wood chips, that changes the flavor and composition and texture of that steak, right? And just like with my solution, since you are able to really get rid of those artifacts, you can really see the changes that those aerosols are occurring. So how's that?
Great, thank you for being also very descriptive. Kate?
Yeah, so mine, I've started thinking about it as, so it's a platform that would be configurable for different purposes. And so a bento box came to mind for me, like where you would have, you'd pick like a style and then there'd be different components and then there would be how you arranged it. And I think it would have a lot of different color and textures, but it would also have like a unifying theme across it somehow, maybe like a particular ingredient or color or something that would make it feel like not a bunch of leftovers in a box. So yeah, that's what I'm thinking.
Yeah, and thank you for drawing it so that we could visualize it with you. All right, so thank you for doing that warm up. Again, it's nice to start meetings like this or workshops like this with 5 to 10-minute activities just to kind of get our muscles working and for us to shift our brain from our previous meeting to our current meeting. And so at this point, I'm going to do a quick recap of design thinking and then talk about implementation. So as we know, design thinking is a human-centered approach to problem solving and innovation. And it's 3 things: a set of mindsets, a replicable method and a process, and then a discrete set of tools and activities. And so design thinking, especially according to IDEO, is really great because it explicitly asks us to consider different aspects of solutions and finding the sweet spot in the middle where it overlaps, and that's what we define as the innovation spot. And so first criteria is looking at desirability. So what is it that humans actually want and need? Second, feasibility, not just technical, but with regards to the real world constraints that we face every day with money, time, human resources. And then the last one is viability. So thinking through, will this sustain itself beyond initial seed funding? And so what is it that will actually stick in the marketplace? And so we've touched upon some of these mindsets in the workshops prior, but we have a lot of mindsets here that I'm confident that you all have already, and others that you will continue to build as you move forward. As we consider the implementation phase, we're really focusing on 2, making it, and 3, learning from failure, as well as 7, iterate, iterate, iterate. And so at a high level, the process looks like this. Again, very linear, but left to right. First phase, inspiration, really getting to understand our end users and how they already experience the challenge or have worked out solutions on their own. Second phase, both creating and making choices with ideation. And so first thinking through all the wild possible ideas before going back and whittling that down with actual criteria. And then the phase that we enter today is implementation. So once you have started some prototyping and have gotten to a point where you're confident that there's a couple or 1 or 2 solutions that you actually want to take to market and see how they do in the real world, how do you actually do that? And then how do you assess whether it's working or not? And then continue to link this, but IDEO continues to update their online field guide to human-centered design with revised and new methods. And so encourage you to flag that particular website and revisit it often as you continue your design thinking journey. And then the last 2 slides, the first one again just shows the difference between traditional business thinking and then design thinking. And so traditional problem solving is where we take all of the inputs and all the information handed to us, and we usually move forward linearly to a single solution, versus design thinking is very deliberate, and we still take those inputs and that information given up front. But before we move forward to a solution, we go backwards to do more empathy, understanding work, to gather more information and insights, to then move forward to multiple solutions. And then again, we want faculty innovation workshop participants to develop a deep understanding of the problem and focus on meeting genuine human needs instead of assuming that we already know what it is that meets human needs and just using that information and moving forward. Creating space and time to explore multiple options and not just one. Today, really focusing on, again, placing small bets fast through experimentation using a prototyping approach, and all throughout emphasizing collaboration and diversity. So with regards to the implementation phase overview, the purpose of this phase is to try your solutions in the real world, to define and collect your metrics of success, to iterate prior to launch, and a plan for sustainability. And so Emily and I went through and put together all of the methods that are currently listed on the website for IDEO's design kit. And so here they are, and the ones that are actually starred are new to the website, and we actually think are really helpful with regards to scalability and then monitoring and evaluation. And so I encourage you to look through all of these resources in the next couple of weeks and sign up for office hours if you want to talk about how you might integrate some of these into your own work. And then today we're going to focus on 5 specific implementation methods through a case study. And so first, live prototyping, so trying a couple versions of your solutions in real time, either face-to-face and gathering feedback, or at least in a way that you would be able to gather real data about how your users are actually engaging with this solution. Second, pilot testing. And so this is something that we might be more familiar with, but once we get to 1 or 2 ideas, really considering real world settings and thinking about how you actually get your solution to users, get them to adopt it, try it out over a period of time, and then collect some data. 3, defining your indicators. And so not just your aspirational goals, but starting to make sure that you have a clear understanding of what your benchmark indicators are. And we'll talk about that more. And then 4 and 5, there are instructions for how you do this, but generally keep getting feedback, even if you think you are done iterating. And then 5, make sure you have a strong monitoring and evaluation plan so that you can keep learning from your users and strengthening your solution. And so thought it would be helpful to talk about some of these methods in the context of a case study so that you can see how I'm working with the team to readily apply some of these methods. And so here is the SaferWays case study. Researchers at UNC are currently developing a mobile app to track community perceptions of crowding, physical distancing, and mask wearing in real time to inform decision-making and reduce COVID-19 risk. And so our team has conceptualized this app as a Waze-like app for campus. And so we are currently in talks with North Carolina Department of Health and Human Services about potentially partnering with them, because we know at this moment in time, anything that's COVID related in the Apple App Store needs to be co-sponsored by a government health agency. And so after several rounds of inspiration and ideation activities, we have started to use the 5 implementation methods listed in the previous slide. And so we went through some initial live prototyping stages. So before we invested real funds to build any web-based or native apps, we created a survey using Qualtrics to prototype with batches of undergrad students. And so we Googled some images, then I think we used PowerPoint to create these images that are now in the prototype version of the survey. We asked some questions with some response options that we came up with, and then tested it very quickly. And so here are some of the questions we asked about: what's the crowd size in this location? Are people wearing masks? And so red is generally riskier and green is safer. And so with regards to setting up the actual live prototyping, materials needed, we needed a Qualtrics survey and a link to that survey. We needed some email language to send instructions to UNC undergrads, and then some contact info for UNC undergrads, where we were considering both extremes and mainstreams when we recruited for that. So in terms of steps, our team created that Qualtrics survey, drafted the email language and sent emails to UNC undergrads, collected and analyzed the survey data, and then followed up with UNC undergrads with additional probing questions via Zoom. And then we discussed lessons learned and then kept iterating. And so we also pre-specified up front certain questions that we wanted answered through the live prototyping. So we wanted generally to see whether students would be willing to rate locations on campus with regards to crowd size, social distancing, and mask wearing. In addition to the responses in the survey, we also wanted to know how many reports would each undergrad submit, how many would include corroborating pictures, because that was an optional thing that they could do. What feedback did they have on the length of the survey? How they feel about the icons that we chose to include in the survey? And would they want to use an app like this? Why or why not? And so in the first week, one of our team members recruited 2 raters who submitted 65 ratings in the Qualtrics survey. And we had asked each team member to put together a report of the raters that they had recruited. And so this is a version of her report back to the team, but she had 2 raters and they rated a lot of different places that we had pre-specified in the survey, including the pit, bell tower, frat court. We asked them at each of those locations to indicate the crowd size of the location. And we also asked how often folks were social distancing. This was when students were still on campus. And so we have 54% saying none or a few. Are people wearing masks? Again, here are the data that these 2 entered. And then how difficult or easy was it to make the ratings? Generally pretty easy. When it was difficult, we asked them why. And we had a lot of comments about places being really big. So it's possible that you could have people in the immediate vicinity of this particular green that are social distancing well, but what does it mean if you can see like halfway down the fields that they're not? And so there was confusion there. And then generally raters uploaded pictures to Qualtrics to corroborate their ratings. We also asked them to crowdsource some health and safety suggestions. And so we're wondering if they would do that. And then also asked for general suggestions for the app. And so with regards to the questions that we had set forth from this initial live prototype session, we had 65 total from 2 people, with 1 rater with 50 and another rater with 15. How many would include corroborating pictures? Both did. What feedback did they have on the length of the survey? Generally, it seemed a little long, but once you got the hang of it, it wasn't so bad. How'd they feel about the icons? Mask icons were hard to understand, and they wanted least risky categories on the left, which is the opposite of what we had. And then would they want to use an app like this? Why or why not? Yes, as long as they weren't being tracked, they want these data to be entirely anonymous. So those are some of our initial lessons learned. So we had many team members. We have 12 people involved in this project, 2 versions of that. And then we came together to talk about lessons learned. And then we took those lessons learned and went towards a pilot. And so after many rounds of live prototyping, we took the lessons learned and built a more robust prototype using a progressive web app that leveraged existing technology. And so here are the screenshots from the current prototype that we have. And so it overlays with Google Maps. We are still using the red, yellow, green for the categories of risk. You can see that we've changed both the wording of the question and then the icons that we are now using to make it clearer and respond to feedback that we got from folks. And for every report that's submitted, you can click on the pins and actually read what people submitted, and then filter in the top left if you want to see reports that were from like the last 15 minutes or reports from the last 6 hours to inform any sort of decision making. And so we are currently recruiting and enrolling different user groups to for a quick pilot study or user experience study. And so we're explicitly recruiting UNC students, staff, faculty, and then Chapel Hill Carbo business employers and employees, as well as general community members who live in and around the university. And so we have the progressive web app, email language to describe what our project is and the purpose of the study after we got IRB approval. We asked users to make 10 or more reports and to fill out a survey as part of our study. We need an email account, a Qualtrics survey to collect feedback, and then email addresses of potential users to participate in the pilot. And so the steps that we took, we worked with a vendor to build a progressive web app prototype, got IRB approval, created the email account, created that Qualtrics survey, draft and sent the email with instructions to different users, and are currently in the process of collecting and analyzing survey data and following up with users. And then soon in the next 2 weeks, we hope to move into this discuss lessons learned and iterate phase. And so as we are doing that and waiting for those that we've enrolled to complete their surveys, we've been diving into discussions about indicators. And so many of us have quantitative training, and the word indicators might mean something to one group of us and then something else to some other group. And so when we talk about indicators here, we're talking about indicators that define data points that we will track, and that can be either quantitative or qualitative, and explicitly making sure that your intervention or solution is using both process indicators and outcome indicators to track progress. And so process indicators typically answer the question, is the solution being implemented or delivered as intended? Outcome indicators typically answer the question, is the solution generating the desired or expected impact? And those desired impacts could be change in knowledge, attitudes, behaviors, any of those. And so indicators are the specific pieces of information you plan to collect. And again, they can be quantitative or qualitative. And as we go through and put together these tables, I'm going to draw your attention to the fact that the indicator is on the left and then the benchmarks are on the right. And so this is not the aspirational goal that you are going for. These are figures that are meant to be the bare minimum to know that you are actually on track. And if you're lower than these thresholds, then you do need to potentially reconsider aspects of your process or the solution. And so I'm going to walk you through a couple of examples and see if you have questions before we have you all try this on your own. But some sample process indicators for our pilot for SaferWays could be the number of recruitment emails we send out to different users, the percent of emailed individuals who actually enroll in the pilot, the percent of users who enroll in the pilot and submit at least one report. Similarly, the percent of users who enroll in the pilot and submit the asked for 10 or more reports, the number of reports submitted during the pilot, the number of users who complete the exit survey, and the percent of enrolled users who complete the exit survey. And so we asked ourselves, what would be meaningful benchmarks or thresholds that if we hit them, we'd feel like we're okay. But if we don't hit them, then we're concerned, and we might need to have a bigger discussion about whether it's the process that we're using or if it's the actual solution that we might need to think through. And so we had said that we wanted to at least send out 100 emails for recruitment, and that we would hope that at least 10% of those individuals would enroll in the pilot. If we didn't hit that 10%, then we'd have a lot of questions about, is it the way that we've talked about the pilot or the ask that we have of folks in the email? Is it that we've, is it part of the process, or is it just like the project described just like isn't interesting? Like people just don't want to try this because they're not really invested in this solution. And so if we didn't hit that 10% threshold, that would be concerning to us. And then similarly, we went through and discussed what meaningful benchmark or threshold numbers would be for the rest of these indicators. And again, these really focus on process and the actual, the solution itself. And so when you actually do this, we find it helpful to have a column that's meant for your benchmark, and then having an actual column or a column that reflects the numbers at the end of your pilot. And so you can actually compare what you marked as a benchmark or a threshold with what actually happened, and then chart next steps if needed. And teams that I work with like to color code because it is easy upon quickly scanning to see how many and which indicators you actually met threshold markers for versus not. And so we don't have the data back for a project yet, but we're hoping to have these tables built out in the next 2 weeks. But let's pretend that these are the data. And so based on the color coding, it looks like we exceeded the benchmark indicators for most of these things, and that 10% is the only one that we fell short of, but we fell short of it pretty substantially. And so if this is the case and we expected 25% of users to make 10 or more reports and only 10% did, then we would need to go back to really understand why folks didn't submit 10 or more reports. Did they find the process cumbersome? Did they, what were the barriers for them doing that, so that we could figure out if it's the instructions that need to be tweaked or if it's something about the app experience that needs to be changed. And then some examples of some outcome indicators. And so again, we're expecting all of our pilot study participants to complete a short exit survey. And so many of these indicators would come from that. So the percent of users who indicate in the survey that the app helps them make real-time decisions, the percentage of users who indicate in the survey that they would recommend the app to a friend, percent of users who indicate that they trust the app, and then the percent of users who are able to describe at least one benefit of using this app, or the percent of users who are able to describe at least one reason why they would personally use this app in the survey. And so we had set 50% for all of these, saying that if we fell less than 50%, then we would need to have some conversations about either the marketing materials or the app itself. And so again, we put benchmark numbers here, and we don't have these data back yet, but I put dummy data in here for this case study purpose. But if we got this data and saw that we were not meeting the benchmark thresholds for 2 of these, we would want to go back to those in our study sample and ask explicitly more questions about why, even though they think that this app tends to help them make real decisions, that they might not want to recommend this app to a friend, or they might not trust the app. And so it's important also to make sure that you are being really intentional about including a range of indicators in your tables, because if I didn't have the second and third lines in here and just had the first, fourth, and fifth, it actually would look like the app is doing really well. And so these questions about whether they would recommend apps to a friend or that whether the app was trustworthy are actually intentionally included, because we know from a lot of the mobile health literature that those types of questions do actually predict use, even if people know that it works, but just for usability. So again, this is how you would use this table. And so once you've identified the solution you're planning to launch, IDEO does actually have additional worksheets to help you think through longer term process and outcome indicators. And so they have these Mad Libs that are actually really handy. And so I put some sample ones in for our project. So in the future, once we have the version that we are launching, a process indicator could be the number of apps that have been downloaded during Q1 of 2021, or the number of UNC students who have been sent the download link during the first quarter. Some outcome indicators might be the percentage of UNC students who are reached by the SaferWays app who test negative for COVID-19 for all of Q1 in 2021. So again, just helpful tools. And then general reminders to keep getting feedback. Gathering feedback from people you're designing with and for is never ending. And so it's important that you keep doing it. And even if you are in the implementation phase, it's totally fine for you to go back to some of those inspiration methods like interviews and group interviews to learn from people, and recommend that we systematically capture the feedback and share with the design team. And then last note, to monitor and evaluate, it takes time and effort to do this well. So we recommend using a chart similar to the one on the next slide to plan and execute. And so making sure that you've dedicated time, resources, and personnel to do this work, but thinking through what your outcomes are, your indicators, how will it be measured, who's gonna actually do the data collection, how often is it gonna be measured, what's the current baseline value, what is the target value, so that more aspirational goal, and then action, who is actually gonna use this data, when and how. And advocating that if there's no plan to use the data, then you, one, will either need to make a plan, or two, if you really don't think that anybody's going to use it, then there's larger questions about whether you want to spend the time, money, and resources in collecting these data. And so last summary before we turn it over to you all to start trying this, the last phase of design thinking requires a different skill set than the first two phases. And so it's definitely more experimental and overlaps with implementation science frameworks like plan, do, study, act cycles. And so that is important for many of us who have public health training and want to use these methods in concert with other methods and approaches that we're already familiar. Second, even if you reach the implementation phase, it doesn't mean you're done with using the inspiration or ideation methods. You can always go back and use those methods because they're still relevant even in late stages. And then the last point is creative processes can still collect and use data to inform decision making. Oftentimes we hear people being like, oh, well, it's a creative process. Like, we don't need data. We'll just go with our guts. And that is fine at times, but it is entirely possible to rigorously combine collecting and using data with creative processes. And so I will pause there and see if folks have questions about the content or the case study before we give you an opportunity to start your own indicator table.
When you're setting benchmarks, do you find that you're typically using that sort of halfway mark, or are you adjusting that based on, you know, where the field is or how certain you feel about things?
Yeah, it's not always the halfway mark. I think it really depends on the indicator that you are choosing. And then it is actually really helpful to do this as a group and to ask people to come up with, like, maybe you come up with the indicators as a group, but ask individual team members to reflect on the benchmark numbers independently before coming back together, because it is fascinating seeing the range that comes back. And then part of the hard work is you as a group deciding what a meaningful threshold is and knowing that you will want higher, but really like what is the number that if you do not reach, you are actively concerned?
Thanks.
And then another question that I usually get following the one that Kate just asked is, well, if we do a couple rounds of live prototyping and it seems like we're consistently crushing that baseline thresholds benchmark number, should we up it? And generally the recommendation is no. And so just because it happens to be working really, really well, when you put together those charts, like think about those numbers as numbers that you're going to sit with for a very long time. And so you wouldn't want to change the goalposts just because you're experiencing success. Like that is the numbers that you set. We really want you to hold as consistent as you are testing, and you can change your aspirational goal for sure. But in terms of the baseline thresholds, we do recommend that those are set and that those remain stable over time. Other questions? Great. Well, I'm sure I'll get more questions as you start doing this on your own. And so we have one activity for today, and we ask you to complete this one activity before next week, just so that we can see where you are with your thinking. I'm going to copy and paste the link to the Jamboard for this week into the chat, and then ask that you find the one that is for your specific project. And we're going to ask you to think about one idea or prototype that you want to move forward into a larger pilot study. And so I know that you might not have thought about it or really want to pick the one that you're going to go with, but for the purpose of going through the exercise, would like you to settle on a prototype that you want to move forward, and then ask that you include at least one process and at least one outcome indicator in your table. And so in terms of what this looks like, we went through and copied and pasted some of the content from the slide deck so you didn't have to flip back and forth, but put together the slide that has the process indicators for our SaferWays pilot, in addition to the outcome indicator table for our pilot with those benchmark numbers, and then gave you blank tables, and then asked you to pick a prototype that you would move into pilot testing, and then to draft your indicators for the pilot, which likely will be a couple days or a couple weeks. Indicate whether it's a process or outcome indicator. And then for you right now, I know you're not with your teams, a draft benchmark value. Again, you're asking yourself, what's the bare minimum to know that you're on track? And if you fall below this, there's cause for concern. And so we'll ask you to try this in the next couple of minutes, and then we will come back and troubleshoot any questions that you have right now. And then I know that a couple of you have started to sign up for office hours for this week and next week. And so I'm confident that we will talk through some of your work from last week and some of your work from this week. So at this point, I'm going to ask that you all spend 10 minutes independently working on your tables. I will be here the entire time, and so will Emily and Melissa. So if you have questions, let us know. But we will come back in 10 minutes and then share out a little bit, and then I will frame what you will be expected to do between now and next week. Are there questions before I set a 10-minute timer? All right, if not, we will start 10 minutes now. And again, we will be here. So if you would like us to answer any questions, feel free to ask them.
Liz, I have a question.
Yes, Carmina.
Sorry to be late.
You're
I had
good.
another meeting that ran over, but I don't know if you answered this, and I can go back and watch the video of it. But you mentioned selecting a prototype. I don't know if you talked about in the early part, how you went about selecting that prototype, or should I just randomly make one up for the purpose of this exercise?
You actually came up with them in your homework that was due yesterday. Like I
Okay.
looked at your table, you actually
Okay.
came up with ideas. So for
Okay.
right now, Carmina, I would just
Okay.
pick one of those
Okay.
and then move it forward. We didn't
Gotcha.
explicitly talk about how you would go about selecting, and so we could do that during office hours if you want more details on that. But
Okay.
yeah, if you want to revisit your previous slide deck and pick one of those ideas to move forward, just for the purpose of this exercise, go forward and do that.
Okay, great. Thank you.
All right, 2 more minutes. Thirty more seconds. All right, we are going to pause wherever you are and see if folks have questions now that you've tried this a little bit on your own.
How often? So, oh, sorry, let me get my video on. There we go. So how often do you want, like, so how, if you achieve a metric, right, and then you want that metric to be revised, I mean, is that something that you do often, or, I mean, because like things like if I achieve this metric, then I want to improve it, right, and do better, then I would change the achievement level, right? That's okay.
Yeah, I was saying earlier that it would be great if your benchmarks were consistent, but your aspirational targets can continue to go up. So you might have an additional column here that's like, well, the bare minimum is a 50%. My current aspiration would be 75%. And if you consistently hit that 75%, you can keep inching that one higher and higher. But as you conceptualize benchmarks, really trying to think through what is that meaningful number that later on, if we fall below, even if it's like weeks or months later after you set them, that you would be concerned. And so arguing for not changing the benchmarks, but you can always up your targets.
So yeah, so those are like danger zone benchmarks. All right, that makes sense now. Thanks.
Yeah. And then I will say, so Will, for yours, you have your last one, number of case studies in field by researchers, so 2 to 3 per year. And so I think that I'm assuming that you were making this as like a, not like a quick test, but this is like your overall plan for something more long-term. And so just if you were looking for 2 to 3 a year, it would just be hard if you were doing this as like a couple week pilot. And so you could change it or just like ask people to provide something that isn't like a published case study, but if there's something that you would expect to see in the short term as an indicator that they would build towards that case study, that might be helpful.
So it's an outcome just for the pilot then. So wouldn't the outcome be for any pilot be the production, the confirmation or production of whatever data that you need? I mean, that would be the outcome of a pilot, right?
It doesn't have to be the exact same data that you would expect in, like, if you were to launch this in the real world forever, because you won't have time to be able to, in a pilot, to be able to figure out, will you actually get 2 to 3 a year? But what are some of the stepping stones that you might be able to see within a couple days or a couple weeks that would give you hope or make you feel like you're on track for those 2 to 3 a year?
Yeah, see, I would change the outcome on it because I was confused. So I mean, the pilot is to produce convincing data of your prototype, right? So
Yep.
the outcome of this pilot would be, the refinement of that prototype to deliver a beta for beta users, a separate one, a newer one, right? An outcome would be then something that other first line customers can use. Would that be an outcome or no?
As the way that I'm defining outcome, it's the one step further. So like that prototype that you create, like what is it that you are expecting what will that solution do for the users of that prototype?
Allow them to use them in the field. So use that in the field. So create these field studies. So that's where I go back to if I can get this pilot to confirm this prototype, then I can get it to first-time customers. They can start using this. And so I can get some of these real case studies in the field by real researchers. And if I can get 2 or 3 of those in the next year, then that sets it up for, a scaling up to more commercial prototype and less of a beta user prototype.
Got it. And so some of the process indicators I'm thinking of might be like the percent of researchers who are able to successfully like set up this equipment in a field site within 2 weeks of receiving it, or something that measures how easy it is for them to actually stand this up in the field. And then an outcome could be like percent of researchers who are able to collect data from these prototype devices within X amount of time.
Percent of the users that you've contacted, not of all the world, right?
Right. So the ones that are in your pilot study.
Right.
Okay. So then you can think about like, what is ideally it would be really easy to use and they would be able to do it quickly. So you could be like, hopefully at least 30% of the people within 2 weeks or 4 weeks of me sending them the instructions and materials would be able to figure this out on their own. And then of those who, are able to set up the device in their field site, like you would hope that at least 50% of them were able to actually collect data. And so we can talk about this more one-on-one, but it seems like you're thinking.
Well, so in my mind, a pilot's different than what you're describing, right? For me, a pilot is a one-off experiment where you're testing out something that eventually others will use. And then the first line users, what you're describing as a pilot would be what I would describe as, your beta testers, right? Who are actually using what you learned from the pilot and now they're using it, because you don't want to pilot anything with real customers. And so, but I think it's just a nomenclature issue. So I'll go with what you've described it. And then I think that's a lot easier for me to do the outcomes and indicators in that way.
Okay. And we can talk about it. It is definitely the naming and the jargon that is, I think, making this slightly more difficult. But if you have more questions as you go through this week, let me know. In terms of next steps, we have only a few because it is the second to last session today. And so my last slide, so that you all get out of here close to 1 o'clock, is that by 12 p.m. on Monday, 10/19. So next Monday, please fill out your Define Your Indicators table if you haven't already. And or if you want me to look at it, please email me and let me know. continue to sign up for office hours using my Calendly. And then again, our final workshop will be next Tuesday. And so if you have any other questions, I'm happy to stay online for a couple minutes, but if not, I will see you all again a week from today.
Thank you for your help.
Thanks, Liz.
Yeah,
Thank
thanks
you.
all.
Liz.
Bye.
Take care. Bye.
Thanks,
Great.
Liz.